So I'll tell you what ends up happening after a 5-day fast. Like, again, the 5-day fast is horrible. I think there's a lot of incredible longevity benefits that happen, but almost immediately afterwards, the performance benefits are through the roof. Like, your brain, you ever seen the movie Limitless?
Yeah.
I mean, I've never had that pill, but it's like that for a while, and so it feels so good. I'm like, oh, I'm going to do this every quarter. Again, that week is hard, but after a couple of days of recovering, man, you feel incredible. So there's a lot of benefits. Even if you take the benefits out, I think what's most important, reason why we do it is modern day primitive cultures do it, not intentionally, because they're going on hunts and they're not getting the kill. Our early ancestors always had these feast and famine cycles. So it's to honor the struggle of our early ancestors, right? And it's to honor these 9 ancestral tenets that always enabled us for millions of years to express robust health. We stopped doing this.
How many times a day do you eat?
Most days it's 1, sometimes it's 2. When we look back through our history, if you think about your grandparents, your great-grandparents, they weren't eating 6 times a day like we do today. They typically ate once or twice a day. When you look at the sort of ranchers, the farmer lifestyle, you'd have a big breakfast before you head out into the fields, and then you come home and, you have your late afternoon or early dinner, and that's when you ate. Again, this whole messaging around eating so often, it all comes from the food industry. Breakfast is the most important meal of the day. Food industry. There's no science that shows this. The fact that you need to eat every, 3 hours, every 4 hours to fuel your day. Again, this is all from the food industry. When you really look at it, we don't need to eat nearly as often as we do. When you look at why is processed food so inexpensive? You start to look at government incentives around, the crops that get subsidized versus why aren't those subsidies going to the ranchers who are raising, cattle? So you have to ask, why is that food the inexpensive food? I mean, the reality is it doesn't need to be that way. We could very easily shift what becomes the inexpensive food for people. And then there certainly is the educational piece of it. Quite frankly, we start to get into the miseducational piece of this because, the predominant messaging around healthy food here in the United States for the past 50 years has been the food pyramid, that, grains, whole grains are the healthiest thing you should be eating. Cereals and wheat and all of this.
That's insane.
It is insane.
That is literally insane.
We have more than enough evidence at this point to know that shouldn't be the case. The food pyramid should essentially be flipped upside down. So then you start asking those questions because it's like, okay, not only have we gotten this wrong, but we got it so wrong that it almost has to be intentional.
If I go to the grocery store, can I eat food from there that is not genetically modified?
You can.
Okay.
But what I usually tell people, and I think a lot of people hear it, don't shop in the inside aisles. That's where you should not be, because that's where most of the processed food lies. Shop on the corners, shop on the outside walls where you have
fruits,
your meats,
vegetables,
fruits, vegetables, and meats, and your dairies and whatever. But, I don't, very little of my consumption comes from the supermarkets anymore. But I've been doing this for a while, and how I was raised is I don't like, you go into a supermarket now, it looks like a cartoon world. Think about that. Go walk up and go film it and then go back and watch the film as you walk down the aisles. How many colors? How many animation pictures do you see? How much manipulation is being fed into your brain? It's like, oh, heart healthy. And it's got a wonderful picture and somebody's very happy and in peace. And, think about the manipulation that goes on with marketing, advertising, injecting chemicals into your food supply. And you are the person who gets to recycle every bit of it, from audio to video to the food itself. You are the test subject, and they make you feel good about it because it tastes good.
The new New York City mayor, Mayor Adams, he's very excited to tell people that he doesn't eat meat. I think he said he's vegetarian or vegan or,
I can tell.
The part that absolutely just sent me over the edge was they're trying to remove meat from the children's diets in the schools. So it's not even just saying, like, it's one thing if you say, hey, protein's important. Let's not eat steak. Instead, we're going to eat chicken, or we're going to eat, even crickets, right? Frankly, okay. But just this whole washing of like protein essentially from the diets and meatless Mondays and coming up with all these like crazy things.
Yeah.
It just falls back to like, just leave the kids the fuck alone.
Yeah, exactly.
Right. And so what do you take as to politicians stepping in and implementing these kind of wide sweeping changes to the diet inside of public schools?
It's going to be kind of a long answer, but I'll give it a reflection as a child in the middle of Texas. We used to, at one point in time, they did feed us soy burgers back in the 70s. Well, that soy was different then. Okay, it was probably a little bit healthier. It was probably good, to go ahead and use the school system and basically provide kids that weren't getting good protein. That was a supplement. Okay, so be it. It's a subsidized supplement that had validity, and that was in the 1970s. Okay, you look at it now and everything. Let's look at the health of a freaking nation right now where our kids are ages 5 to 11 now, 46% of them are obese or overweight.
It's crazy.
1 out of 2 is going to diabetes or already has diabetes. That's the health of our kids in this nation. That is a fucking genocide. And if people do not start understanding that, we're going to kill our kids in a way that we don't see, but we're going to let these stupid politicians do it. That's where we say no more.
I mean, the nice thing around health, when people tell me like the climate is getting warmer, I have really no way to personally verify that. I can't go outside and say, well, it was hot today, it must be, or it was cold today, it must not be. I can't confirm that. What I can do is I can look in the mirror and say, am I healthy or am I less healthy? I mean, that's pretty easy for all of us can verify that. So whatever you're doing intervention-wise, you should be able to know that my energy's better, my joints don't hurt as much, I sleep better, my mood is better, my libido is better, my body composition is better. That's something you can independently verify. So this is a nice thing about that. They can, it's hard to gaslight people into although they're trying, they're trying to normalize obesity and say, oh, it's healthy and everybody should be this way. And we're promoting that there. And the problem with that is we're accommodating that, we're normalizing it, and we're creating more of it. And those people, guess what? Guess who makes a lot of money on those people? When everybody's sick and overweight, they require more medication, they require more services. Companies that benefit that are those are the recipients of that.
We've essentially in the West prioritized people's feelings over objective reality, even when that's extremely detrimental. You want to see another great example of this? Look at this whole fat acceptance, body positivity thing. Right?
It literally is wild.
It's wild.
Yeah.
It's wild, right? Obesity is being promoted, and this is the biggest killer of people. This is a problem that, again, it didn't really used to be a big problem. You could go back less than 100 years ago, and obesity was very rare. Obesity was very rare. And just in a century, in one person's lifetime, we've got into a stage where the majority of adults in this country are overweight or obese. The majority, right? Childhood obesity did not used to exist, right? You look at fat kids from like the 70s or the 80s, and it's like, oh, he's only like slightly chubby. Now it's like a fat kid weighs more than I do, right? And it's getting worse. And it got worse over the last couple of years, despite the fact that 80% of the people hospitalized with the Rona, overweight or obese. Can't talk about that. And it's like, dude, do you care? Do we care about like not offending anybody, or do we care about actually trying to help people?
And what a lot of people don't realize when they're trying to lose fat, even if you're working out intensely, 80% of the calories that you're burning are going to be burned outside of the gym. And so a lot of times people will say, well, I got to go do all this cardio. I got to, go lift all this and that. Well, they're not thinking about how is this affecting the 80% of the calories that I'm burning outside of the gym. And the same thing is true with how they eat. You can actively withdraw calories from your diet, but that doesn't mean that there's going to be no impact on the amount of calories that you burn at rest. The most important 2 things for long-term fat management or weight management is figuring out how to burn a lot of calories at rest in a training side and then on the diet side, right?